Okay, hello everybody. Thanks for being here. I'm Kayla, you all know me. Tonight I'm going to be talking to you guys about organ donation and the importance of becoming an organ donor. The need for organ donors is growing at a constant rate, and there are simply not enough organ donors to fulfill the needs of everybody on the waiting list. If you were to ask a person to think of somebody who saves a life, most likely you would think of a doctor. However, you do not need to be a doctor to save a life. You can simply become an organ donor. Organ donation after death is a simple and selfless act that can save many lives. The numbers of patients waiting for organ donation far exceeds the number of people who are registered organ donors. This is a huge problem. According to organdonor.gov, 119,000 people are currently on the waiting list for an organ, and only 15,062 people are registered organ donors after death. This means that 22 people die every day waiting for an organ, while every 10 minutes one more person is added to this list. Now that you have an idea of the dire need for organ donors, I would like to talk to you about what it means to become an organ donor, as well as what organ transplantation is. A brief history on organ transplantation, the benefits of organ donation, and what the process of matching donors to a recipient looks like, as well as how everybody in this room can become an organ donor. What is organ transplantation? According to medlineplus.gov, organ transplantation is taking a healthy organ from one body and placing it into another body in place of an organ that is failing due to injury or illness. Organs can come from living donors or a donor that has already passed away. Now that you have a clear understanding of what organ donation is and what transplantation is, let's talk about the history of organ transplants. UNOS, which stands for United Network of Organ Sharing, reports that the first organ donation took place in 1954. This transplant was a successful kidney transplant. By the late 1960s, there were successful transplants of the liver, the heart, and the pancreas. Intestinal organs and lung transplants came in the late 1980s. The biggest limiting factor in organ transplant procedures was organ rejection. Until the 1980s, when a major medical advancement in rejection treatment and prevention occurred. This statement also comes from UNOS. Now that we all have an idea on the background of organ transplantation, let's talk about the many benefits of organ donors. One person can save up to 8 lives and improve the quality of living of up to 50 people by becoming an organ donor, according to liveonnewyork.org. Let me break that down. 1 heart, 1 liver, 1 pancreas, 2 lungs, 2 kidneys, and the intestines can all come from one donor. Just to give you guys a further idea of that, I'll share this picture with you. So what comes from one donor is the pancreas, kidneys, intestines, liver, heart, and lungs, as well as the cornea, the tendons, heart valves, skin, veins, and bones. Each year, 46,000 people have their sight restored thanks to donors. 1 eye donor can benefit 10 people. Last spring, I had a great uncle that passed away, and he was an organ donor. Him being an organ donor benefited 3 people, and they regained their eyesight. Now that we all have an idea on the background of organ transplantation, let's talk about the many benefits that come from organ donors. Matching donors to a recipient. How does that work? Each organ has a different policy simply because each organ can survive outside of the body for different amounts of time. I have a chart right here for you guys that says that the heart can survive outside of the body anywhere from 4 to 6 hours. The lungs can also survive outside of the body for 4 to 6 hours. The liver can survive outside of the body for 8 to 12 hours. The pancreas can survive outside of the body for 12 to 18 hours. The kidneys can survive outside of the body for 24 to 36 hours. And the intestines can survive outside of the body anywhere from 8 to 16 hours. However, every organ donor to recipient match must follow this criteria: blood type, blood size, severity of patient's medical condition, distance between recipient's hospital and donor's hospitals. This is due to the different amounts of time that each organ can survive outside of the body, the patient's waiting time, and if the patient is currently in a condition to receive an organ. This means that each patient cannot have any current infections, because this would lower the success rate of the transplant. As you can see, all of these factors are essential to the donor-recipient matchup, but these factors also make it much harder to find a suitable organ match, because every match must be just right. That's why I believe it is so important for the number of donors to grow, because the more donors there are, the higher the chance of finding the perfect match for somebody on the waiting list. Who can be an organ donor, and how can you become one? The answer to both of those are extremely simple. Anyone and everyone over the age of 18 can become an organ donor and should. Your existing health condition does not play a factor in whether or not you can become an organ donor. Medical professionals will view your organs after you have passed away and will determine their eligibility, only if you are a registered organ donor, of course. Where can you register? The most common place people register is at their local DMV when they are signing up for a license or renewing their license. However, you can also register at organdonor.gov, donoralliance.gov, or visit the U.S. Department of Health and Human Services at hhs.gov. I've addressed the problems of too few organ donors to fit the needs of everybody waiting for an organ transplant, and I have presented a very simple solution. Simply sign up to be an organ donor. I hope that this information on what organ transplantation is, how the process works, the benefits, and the easy ways to sign up to be an organ donor will encourage and persuade each and every one of you to sign up to be an organ donor and save a life or 8. Thank you for listening.